One of the things when we were thinking about moving here was how are we going to navigate healthcare, right? So now that we have our temporary residency, with your help, I have been able to get medications. So I really wanted to just introduce you and talk about the services that you provide and how you can help.
Okay, so by name, people know me as Mariangel. For the terms of this video, I think it's Dr. Mariangel Mora. I live here in Coco. I'm a primary care doctor here. And basically what primary care sees is everything, ages from pediatric to the elder. And then anything that goes over basically our expertise, then we refer up to the higher level. I've been living in Coco for the past 3 years, but before that I was kind of raised here. I think I've told you before, but like my dad used to own a sport fishing company in Coco, so I grew up, or I think I was made here. I don't know if I can say that. Yeah, that would be a question for my parents. But yeah, I grew up coming to Coco, so I'm very rooted here with like the changes that Coco has endured, and basically I do feel that I'm a local to this area. And then after X amount of years of working in different things, I was able to come back to Coco and stay permanently.
It has been so unbelievably helpful for you to help me navigate. And I think that's the important thing, because you have different services that you offer, right? So I was talking about with Caja, which is the Social Security here that we pay for as temporary residents.
I mean, we can do a little introduction on that to like get people acquaintance, because we don't know if your audience maybe also is looking from away from Costa Rica.
Yeah.
So Costa Rica has a like universal health system, basically, and what that means is that there is like a governmental healthcare system that basically sees everyone, and everyone gives a contribution based on what their salary is or what they declare as a salary, right? Besides that universal health system that is governmental, there's also private practice. Right, and private practice is basically just going to a doctor and you pay for your services outside of this quota that you're giving every month. And basically when all the people that want to come to Costa Rica and they become residents like Lexi, they have to give a contribution to this system, therefore they are covered by this system. This system will supply with emergency care, in the sense that if she has something that will or could terminate her life in the next couple of hours, she gets covered by this system. And then there's also like general practice, but for that there's a little long wait of getting into the system as to get a consultation, so that's where I come in. And basically I am registered as a mixed doctor into this system. So how that works is that, for example, Lexi would be using my services of general practice privately, say she would pay for my consultation, but then I can provide her with scripts, references, and requests for studies like lab work, imaging, x-rays, or references to the specialist in that specific governmental health system. So that would be one of my services, basically.
And I wouldn't know how to navigate that. I mean, I didn't even know what Ebais was. I walked in there that day, and you had written me that note in Spanish, and you're like, here's the number and all this, and I just handed it to the cashier because that was what got me in the system.
Yes.
Right? I would never have known how to do all of that.
Ebais is EBAIS, and is this comprehensive healthcare units of Costa Rica that like have a general doctor and a secretary, and they basically are in each neighborhood based on the amount of population that Costa Rica has, and that's where Lexi would retrieve her medications, in this sense, out of the Ebais of this community.
And they have private hospitals here, like you were talking about, and private practice, and those are usually a lot less expensive than in the U.S.
Yes.
Right, and even when I went in to get a CT scan at one of the private hospitals, I mean, you pay there, and it was $700.
An MRI scan, depending on the area, right, is also like $600,
Yeah.
which in the States, I mean, I've heard it goes up to like $2,500,
Yes,
right?
exactly.
And also another thing that is very interesting to Costa Rican health system is that you don't really need a script for everything.
Yeah.
Okay, there's more medications over the counter here that you would encounter back home. There's also, you have a say if you want to go to a blood work analysis office and say, I want to get a full blood count. You can just go and ask them, like, hey, can I get a full blood count? But, I mean, if you can read it after, that would be a different question, right?
Right.
I mean, some people have a little bit more knowledge of this thing, so they could maybe read their own blood work, but it would be then after that you could choose to either call me or any other physician close to you to be able to analyze those results.
But I could get the lab work at Ebais
Yes.
for free. So that's where I would have you go
To write
ahead
the
and-
script.
Yes.
Yes.
So that's, again, I think that's a good balance. And as I become fluent in the language, as I continue to study, I think it'll get better. But for someone that's just moving here, or even somebody that's here, like a lot of people come 6 months out of the year.
But they're still residents, right?
Yeah.
Because they have to be registered through.
Oh, they have to be residents,
Yeah.
yeah. But if not, they still have the private care.
Yeah,
Right? And that's
and-
the thing that you can do for them. It's the convenience factor. You do house calls.
Yes, and also I can provide with the mixed medicine script so that the rest of the things that they would need would be free.
Yeah.
Or free out of that contribution that they give monthly
Yeah.
to the system anyways.
Now, I know that you can also get private health insurance here, so I've looked into some of
Yes.
that. I think the issue that because I'm going to be moving here before I'm eligible for Medicare,
Sure.
right? So if we move here and we retire early, I won't have health insurance in the U.S., and if I have to buy it there, it's incredibly expensive, if we have to get private insurance. So I've looked at some that will cover things both in the U.S. and here, and then there's just the private insurance here. There's also like MediSmart. That's where it's
Yeah.
like a discount program.
Yeah, that's a
right?
discount program, and it's basically out of this like private organization that developed it. They have their own hospitals, which would be Metropolitan
Yes,
Hospital.
right, which I've been to, yeah.
And they provide for discounts over certain lab work, so certain specialist consultation. I mean, you would have to like research a little bit on what the actual pros and cons are of those benefits. But maybe if we had a private consultation and you would ask my opinion on if you should get one or the other, I mean, I'm also here to guide you with anything in that regards. That's some of the things that we can help you with as general doctors. I wouldn't say that all general doctors will help you navigate Caja, but I'm a small community doctor, and I do think that there's a lot of benefits, even for myself as a doctor, in how I approach my patient by disclosing all of this information.
Yeah.
Yeah.
So also, though, I know that there have been emergencies where, I've even been in one and made a phone call to you. I chopped my finger off.
So it is important to say that there's emergencies and then there's urgencies.
Urgencies.
Right?
That was urgent. That was not an emergency.
Lexi had this incident the other day, and she accidentally cut the tip of her finger. And I mean, she cannot just like walk around with a bleeding finger. So that would be an urgency to be tended in the following 1 hour to hopefully not more than 3. So yeah, I also care for urgencies. Emergencies would be anything that could terminate your life in the, say, hour, 2 hour ratio of time. So for those, I mean, I'm definitely available for a call to tell you basically how to guide you to where you should go. Yeah. But for this scenarios, it is better for you to just jump in a car right away
and get to the hospital.
Get to the hospital.
But even that, like, which one do you go to? What's the best hospital to go to? I mean, I called because a friend of mine, her daughter had an accident or had some swelling in her foot, and she was in Santa Cruz, remember? So you also helped her know where she needed to go.
Yeah,
And
I guess guidance, I would say consulting on how to navigate Costa Rican's health system based on the area that you're living in. It's also something that I provide to explain. I also believe that it's like to each its own decision, and if I can aid into you guys being able to take advantage of what you're paying for, it's something that should be given to you while you're paying for the system. So why not, right? Why not helping out?
a nice, unique service that you offer I have taken advantage of before, and it's the IV therapy. Now, it's not, it could be because somebody's ill and they need to have an IV at home, right? They're dehydrated. Or it could have been that somebody was out drinking a little bit too much the night before. And
haven't we? I'm definitely not gonna promote people overly drinking or overly partying.
I can speak from experience.
Haven't we?
Yeah, so
done
tell
that?
me about, like, so do you can do customized
Yeah, it's like
mixes?
cocktails, basically.
Yeah,
I call them cocktails. It makes it sound a little more fancy or fun. But IV therapy can be used, of course, therapeutically, as you said. Like if a patient is severely dehydrated, because we live in this country with the humidity and you're not used to it yet, so you can get a little bit of a heat stroke. Or there's also, like, normal medical conditions, not normal, but like common medical conditions, say you're vomiting or like diarrhea, and all of those produce dehydration. So for those, we use IV therapy in that therapeutical, more acute scenarios.
Right.
Also, after getting a flu for an X amount of time, sometimes bringing these cocktails into your body, vitamins, mega doses of vitamin C, B complex, B vitamins, zinc, could also prevent the recurrence of a flu. Because sometimes we feel very weak after we're sick.
Yeah.
So all of these are scenarios where we can use IV.
Anything else you want to tell us about? Any other services that you provide?
Sure.
Or how people can contact you?
And you can definitely reach out through my WhatsApp. I will definitely give Lexi my information so that she can, maybe it's somewhere already posted.
There.
Right there, or right there. We'll see what the cameraman does. Most of the services that I can provide, I can do at the comfort of your house. I like being up and close with my patient. Like, my practice, I think, is very holistic. Outside of that general practice, the counseling on how to navigate the health system of Costa Rica, I also come with you to your consultations with the advised doctor, because sometimes these doctors don't speak English at all. I also come with you as a interpreter, and also because I'm your doctor, I also get an insight right away of what's going on in the case I need to provide more support in that scenario. I also do Botox, but that's something that we can navigate together.
Do you do that also for migraines?
Yes.
Yes, okay.
So migraines is one of them, TMJ. Also for people that have bruxism, which is like they tight their teeth at night. I do hormonal pellets and topical hormones as an hormonal replacement therapy for male and female. a little bit about nutrition. I'm not a nutritionist, but I do believe that like a holistic approach has a little bit of nutrition, counseling, lab work, and test analysis. But it's just a little bit of the things that I provide.
So you do all those house calls, and essentially, like, that's what we call concierge medicine, because you're there on call, and like you said, you can show up in, hopefully within 1 hour, but up to 3.
I mean, I do have connections in most of Costa Rica, but I do reach out to my colleagues. I am of the opinion that there's no real competition here based on like your health. You can choose, and you don't really have to choose me.
Yeah, and I have to say that, so when I had a pretty bad injury in the hospital, the emergency hospital in Huacas, which is small, it was Metropolitano.
Yeah.
They did a fantastic job.
No, and you can barely see it.
I know.
It's
they
amazing.
did an amazing job. So I think that the healthcare here in general is amazing.
Interestingly,
It really is.
we are number 36 in the world.
Yeah.
So that's
above
pretty
the
high.
US. Above the U.S. Yeah, so the physicians are trained very well.
Yeah, I mean, I think the main issue is, as we're doing these videos, is to try to explain people where to go, where you will find it, so that you have the ability to react quickly. Mm-hmm. It's not that the health system here or the providers of health don't have the expertise or like the means to be able to help you. But sometimes it's like being new in an area where like you don't know how it works, where to go, who to go to. I think that is like what we're trying to do here, to be able to provide this information so that you can act quickly on behalf of yourself. I think it's amazing what you guys are doing to provide this information to people, expats in general. I mean, I've seen them, they're fun. I have shared it even with locals, like we've had a blast. So I mean, if I'm gonna suggest something, follow and subscribe their YouTube, because they'll be doing a lot more, and I can't wait for the next one. Thank you. How low do you want me to talk?
You're fine.
Okay.
Talking in normal voice.
Did I step on shit? I can smell it. You guys look great, by the way. I think I missed you dearly.
I did too.
Are you gonna tell us when to start, or is this recording already?
Is it recording now? Okay. Are we recording? So, when I moved here, oh, no, I didn't move here yet. So blah, 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 blah.
I don't know, I think we do. Is he listening to us?
No, it's only here. Here, go like this. You have a mosquito on your head.
Oh.
There, he's off now.
I think I was made here.
You can say you think you were made here. Mosquito. Okay, Buzz, we're done. And I just don't remember how to turn off all the cameras.